So why do we use a rigid stylet when we're intubating? So a rigid stylet is basically a metal rod that goes inside of the endotracheal tube before you put the endotracheal tube in, and it's malleable by nature, which means you can actually bend it. It can bend and fold however you want it to. And so why do we use that? We use it because it gives the endotracheal tube structure. Zena wants to join. Zena, you want to join? Okay, never mind. So it gives the endotracheal tube structure, so it's easier to pass through the vocal cords. It's sort of more tough to move through the vocal cords. And also because you can angle it however you like. So if you want to follow a certain angle, you can bend the tube a certain way to follow that angle. But the downside is it can cause trauma, right? You never want that sharp end of the rigid stylet to be poking out of the end of the tube, because if it does, then you can injure the trachea. And but that's why we use the rigid stylet. Do you use a rigid stylet when you intubate? And maybe next time we'll talk about a trial that actually compared using a stylet to not using one. And if you found this helpful, follow for more ICU Made Simple.